depends on how contagious a disease is. As this chart shows, measles is very infectious. One person can pass it on to 12 others. And so for herd immunity to work, around 90% need to be immune. But coronavirus reproduces at a far slower rate, so successful containment requires just 60% of people to have been infected and developed resistance. Now, taking the UK as a whole, that's around 40 million people catching COVID-19. It suggests 32 million, or 80% of them, would have mild symptoms. But that means around 8 million could have severe or critical symptoms and would need treatment in hospital, which is expected to last around 3 weeks. And that would put considerable strain on the NHS. But of course, that assumes you haven't isolated the most vulnerable people, and that could be crucial.
Why the advice that is being given to our government does seem to be different to the advice being given to many other governments who are taking...
We've got a panel of very world-leading scientists across epidemiology, mathematical models to try to reduce the peak of the epidemic and broaden it so that you don't end up with so much intense pressure on healthcare systems at one time. Second, of course, is to protect the elderly and vulnerable and to make sure that during that peak they are protected as well as you can, because
why, if you're trying to delay the spread of the virus, and people can understand why you would want to do that, why we basically seem to be allowing society to continue. There's no lockdowns, there's no shutdowns of schools or education facilities. That actually going to be problematic in terms of trying to delay the spread of the virus.
The UK has actually done a good job of contact tracing and isolating. So the first phase of this means that we're a little bit behind in terms of where the outbreak is compared to others. And the measures that were announced, which is about self-isolation, even if you've got very mild symptoms, will mean a large number of people actually at home being isolated because of this infection. That's a very big measure, actually. It's going to have quite a big impact across a number of which, you're quite right, are things that do have some effect and come in at the right time. Mass gatherings is the one that keeps coming up. And mass gatherings, of course, are a place where you can potentially get infection from somebody. But the alternative is also important, that if you're not at a mass gathering, you're at a small gathering, and most of the transmission of these types of viruses occur in small gatherings, not in big gatherings, and therefore this concentration on getting people who've got symptoms into their house isolated, potentially the next step to ask households to do it, so you contain the whole thing in a household, and making sure we protect the vulnerable and elderly are the first three things we need to do. It doesn't, of course, stop the possibility that even relatively soon you need to do more than that. But getting this right and making sure that we can monitor the outbreak is absolutely key. It's, of course, that if you completely locked down absolutely everything, probably for a period of 4 months or more, then you would suppress this virus. All of the evidence from previous epidemics suggests that when you do that and then you release it, it all comes back again. So the other part of this is to make sure that we don't end up with a sudden peak again in the winter, which is even larger, which causes even more problems. So we want to suppress it, not get rid of it completely, which you can't do anyway, not suppress it so we get the second peak, and also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
Yeah, I mean, that herd immunity, I know you talked about yesterday when you were appearing with the Prime Minister. In terms of building up a herd immunity within the UK, what sort of percentage of people need to have contracted the virus?
Probably about 60% or so. And we think that this virus is likely to be one that comes back year on year, become like a seasonal virus, and communities will become immune to it, and that's going to be an important part of controlling this longer term.
But before these roadblocks and controls were put in place, who knows how many
President Emmanuel Macron on Monday.
As of Tuesday at noon, and for the next 15 days, our movement will have to be severely limited. That means outdoor gatherings with family and friends will not be allowed. Anyone who does not abide by these guidelines will be punished.
Grocery shopping, going to work when working from home is impossible, and providing assistance to at-risk family members some of the few exceptions to the rule. Aside from those, anyone out without a valid reason will face a fine.
Un dispositif de contrôle sera
There will be checks and verifications that will be carried out by law enforcement agencies. There will be both fixed and mobile checkpoints.
On lockdown,
pour nous protéger.
We need to be able to protect ourselves and to stem the spread of this virus. We need to preserve our current medical system. As of Tuesday at noon, the European Union borders and the Schengen borders will be closed.
Seront fermés.